This is the Justicefighter podcast. Justicefighter podcast. With attorney Gerald Griggs. Attorney G. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justicefighter podcast, y'all.
What's going on, guys? This is attorney Gerald Griggs of Justicefighter, and we are here on Justicefighter podcast. And we've been off the air for a minute, but I wanted to get back to you in the middle of all this coronavirus and have a real deep conversation. And this article came to me a couple days ago from ProPublica, and it started to elucidate some real troubling statistics. And the article is from ProPublica. It says, early data shows African Americans have contracted and died of coronavirus at an alarming rate. This particular article came out April the 3rd at about 1:21 p.m. And I think we really need to have a real conversation about this. And so the article goes on to say the coronavirus entered Milwaukee from a white affluent suburb, and then it took root in the city's black community and erupted. As public health officials watched cases rise in March, too many in the community shrugged off warnings. Rumors, conspiracy theories proliferated on social media, pushing the bogus idea that black people are somehow immune to the disease. As much of the initial focus was on international travel, so those who knew no one returning from Asia and Europe were quick to dismiss the risk. Then, when the shelter-in-place order came, there was a natural push among those who recalled other painful government restrictions, including segregation and mass incarceration, on where black people couldn't walk and gather. We were like, we have to wake up, people, said the Milwaukee health commissioner. As the disease spread at a higher rate in the black community, it made an even deeper cut. Environmental and economic and political factors have compounded for generations, putting black people at a higher risk of chronic conditions that leave the lungs weak, immune systems vulnerable, asthma, heart disease, hypertension, diabetes. In Milwaukee, simply being black meant your life expectancy is 14 years shorter and on average than some white people. As of Friday morning, African Americans made up almost half of Milwaukee's 445 cases and 81% of its 27 deaths in a county whose population is 26% black. Milwaukee is one of the few places in the United States where there is tracking racial breakdown of the people who have been infected by the novel coronavirus. After a glimpse at the disproportionate destruction it's inflicting on the black community nationwide, in Michigan, there was a state population is 14% black. African Americans make up 35% of the cases and 40% of the deaths as of Friday morning. In Michigan, the state's population is 14%. African Americans make up 35% of the cases and 40% of the deaths on Friday morning. Detroit, where a majority of the residents are black, has emerged as a hotspot with a high death toll. As in New Orleans, Louisiana has not published case breakdowns by race, but 40% of the state's deaths have happened in Orleans Parish, where a majority of the residents are black. Illinois and North Carolina are two of few areas publishing statistics on COVID-19 by race, and their data shows a disproportionate number of African Americans infected. It is unimaginable pretty soon, said Dr. Celia Maxwell, an infectious disease physician and associate at the Howard University College of Medicine, a school and hospital in Washington, D.C. dedicated to the education and care of the black community. And anything that comes around is going to be worse in our patients, period. Many of our patients have so many problems, but this one is kind of like the nail in the coffin. The United States Centers for Disease Control and Prevention tracks virulent outbreaks and typically releases detailed data that includes information on age, race, location of the people affected. For the coronavirus pandemic, the CDC has released location and age data, but it has been silent on race. The CDC did not respond to ProPublica's request for race data related to the coronavirus or answer on whether they are collecting it at all. Experts say that the nation's unwillingness to publicly track the virus by race could obscure a critical underlying reality. It is quite likely that the disproportionate number of people who have died from the coronavirus will be black. The reasons for this are the same reasons that African Americans have disproportionately higher rates of maternal death, low levels of access to medical care, and higher rates of asthma, says Dr. Kamara Jones, a family physician, epidemiologist, and visiting fellow at Harvard. COVID is unmasking the deep disinvestment in our communities, that historical injustices that impact our residential segregation, said Jones, who spent 13 years at the CDC, focused on identifying, measuring, and assessing racial bias in the medical system. This is the time to name racism as a cause of all of these things. The underrepresentation of people of color in poverty and white people in wealth is not just happenstance because we are not valued. 5 congressional Democrats wrote the Health and Human Services Secretary, Alex Azar, whose department encompasses the CDC, last week, demanding the federal government collect and release the breakdown of coronavirus by race and ethnicity. Without demographic data, the members of Congress wrote, health officials and lawmakers will not be able to address the inequities in the healthcare outcomes and testing that may emerge. We urge you not to delay in collecting the vital information and to take the necessary steps to ensure that African Americans have access to the coronavirus COVID-19 testing and treatment. Milwaukee, one of the few places already tracking the coronavirus cases and deaths by race, provides an early indication of what would surface nationally if the federal government actually did this, or locally if others, cities and states took the lead. And so I've been getting this type of information, and I wanted to bring that article to your attention. That's parts of the article from ProPublica, and again, it was released on April the 3rd at 1:21 p.m. and was by Akila Johnson and Talia Buford. And thank you for that insightful breakdown. But we need to have this real conversation, because there are not demographic breakdowns, but we can tell by the hot spots that are occurring that there may be a large disproportionate amount of African Americans affected. We have to look at the hot spots. The hot spot in New York, hot spot in New Orleans, hot spot in Chicago, hot spot in Detroit, hot spot in Atlanta and Fulton County, hot spot in Los Angeles, California. These are large urban areas, and we know they have large African American populations, but we're not getting that information. And I think one of the biggest canaries in the coal mine is Albany, Georgia. Albany, Georgia has a disproportionate amount of African Americans in Dougherty County, and it's one of the biggest hotspots in America. So we have to keep our eye on this information and request from our elected officials a breakdown of the data by race so we can get to the underlying issue. And we have to dispel the myths that are floating around on social media. Black people are not immune to this disease. Matter of fact, black people are disproportionately being affected by this disease. I know of at least 7 individuals that I know of that are currently infected. And I know large amounts of individuals who've had family members from Dougherty County that have succumbed to this virus. We're hearing the anecdotal evidence every single day out of New Orleans. We're hearing the anecdotal information out of Detroit every single day. We're seeing the viral videos every single day. And we have to respond in real time to this growing pandemic, not only from a global perspective, not only from a national perspective, but also from a racial perspective, because we all know when America catches a cold, African Americans and other minorities catch the virus and die. And so we need to be more receptive and insightful in this information. And my hat goes off to the elected officials in Congress who have written the Department of Health and Human Services to get this information from the CDC. It's important that they release all of the information and the underlying data in their responses to the testing and the biographical information that they are receiving, so the public can break it down in real time. And so I wanted to bring that information to you on this platform so that we can be informed about what's actually happening on the ground in real time. My hat goes off to the black journalists who are bringing this information to us in real time so we can break it down. Again, I've seen articles in ProPublica. I've seen articles in The Atlantic. I've seen anecdotal evidence on social media from our social media bloggers who are bringing this information to the forefront. And we have to keep sight on what's actually happening in real time and bring it to the people so they can digest it. It's time for us to have a complete response to this and not leave any communities behind, specifically the communities of color and African American communities and communities that are in poverty, because we all know, especially in Georgia, that there's a disproportionate amount of healthcare response to certain communities. There are rural communities that don't even have hospitals. So we need to make sure that we have a unified response to this. So we're going to continue to bring this to you on the platform. This is Justice Media. This is the Justice Fighter podcast, and we will be right back after this short break.
This is the Justice Fighter podcast. Justice Fighter podcast. With attorney Gerald Griggs. Attorney G. where we have conversations on social justice, civil rights, and political news that affects us all. Let Attorney Griggs put you on game. Only on the Justicefighter podcast, y'all.
And so we were just talking about the coronavirus and its effect on African American communities. And I came across another interesting article, and this is from BuzzFeed News. This was released on March the 22nd, 2020 at 11:13 a.m. by Nadita Parish, a BuzzFeed News reporter. And the headline of the article is, "Doctors are concerned that Black communities may not be getting access to coronavirus tests." And this kind of underscores what we were talking about in the other segment. Approval for coronavirus COVID-19 testing is particularly vulnerable to implicit bias, doctors say. And the doctors kind of went on to outline their concern. A group of doctors in Virginia is calling for the Centers for Disease Control and Prevention and the World Health Organization to release information as whether Black communities are being left behind as the shortage for coronavirus tests in the United States continues. They are concerned that Black communities and other underserved groups may be disproportionately missing out on getting tested for COVID-19 in the absence of data breaking down who's being tested so far by race and ethnicity. We know the United States has a great discrepancy in not only the diagnosis, but also the treatment that African Americans and minorities are afforded. So we want to make sure that that in this pandemic, that brown and Black people are being treated the same way, that these tests are being made available the same pattern as for the majority community of white people, said Dr. Ebony Hilton, an associate professor of anesthesiology and critical care medicine from the University of Virginia. Currently, the CDC coronavirus information site says that there are 66,371 people across the United States have been tested for the virus. And again, this information is coming from March. We do know that earlier this weekend, they indicated that there are going to be 1 million tests available. So the largest data on the site says that 15,219 confirmed cases nationally. And of course, we know that number has gone up as well. The data provided by the CDC does not include a breakdown for who's been tested by demographics. Johns Hopkins database, which pulls data from global, national, and state level reporting, says that there are more than 26,000 confirmed cases in the United States, but does not include statistics on testing. And again, these numbers are old numbers, but it kind of underscores what's going on. The doctors say there's a deep-seated inequity that disproportionately affect Black communities, like a lack of paid sick leave and adequate health insurance, income disparities, and access to medical facilities can heighten the effects of a crisis like the coronavirus outbreak. I don't want to speak about Black Americans as if we have the same, but there's a lot of reasons to trust the government. There's a lot of reasons not to trust the government to be fair in circumstances like this, says Dr. Cameron Webb, who is running for Congress in Virginia. There is a huge question. There's a huge question who has access to the test. If you're not an NBA player, it might be a little harder for Black people to get access to the test. Finding out who has access to the test so far would mean that we're able to correct our disparities or biases in the healthcare providers, said Dr. Lee Ann Webb, an emergency room doctor at the University of Virginia. Hilton added that doctors have relied on a lot of diagnosis and can't be quite subjective to decide whether someone can get access to the test or not. She said getting data of who has access to the test is a pressing issue. With corona having such high mortality rates, with the test being limited, and with testing also only coming based on subjective descriptors, the only objective descriptor that we have is the fever. The people who are not being tested, if testing is warranted, they need advocates. And as much as they can advocate for themselves, having people specifically who are interested in health disparities, to have people who have seats at the table advocating for us is imperative. And so those are the doctors speaking in real time of the need for health access advocates in this moment, in this pivotal moment of where we're deciding who gets access to the test, who gets access to health care, who gets access to the information and data that could particularly break this down. And I think this is important in this moment, that we not shift our focus away from the underlying issue and the underlying question of class, race, ethnicity, and access. So we're going to continue to bring this information to you. Again, this is a issue that's been raised not only by healthcare providers, not only by doctors, but also by our elected officials about the data and efficacy and information and access to knowing the statistical breakdown and demographical breakdown of where the coronavirus is, how are we being provided the testing information, and who's being affected. We can see as it continues to spread that there are certain hot pockets that are growing in urban communities, and that begs the question, what's the access look like? What's the demographics look like? And why are we not receiving this information? So again, on the platform, we will continue to bring you this information. We wanted to bring it to you. The question is, what are we doing for brown and black communities during this pandemic? We need to ask the Centers for Disease Control. We need to ask the Health and Human Services certain questions, and it's time for it. And we're going to do it on Justice Fighter Podcast. So stay tuned to the next episode, and I will be talking to you. This is the Justice Fighter, Attorney Griggs, and I approve this message.
This is the Justice Fighter Podcast. With Attorney Gerald Griggs. Where we have conversations on social justice, civil rights, and political news that affects us all. Let Attorney Griggs put you on game. Only on the Justice Fighter Podcast, y'all.
And so, guys, Justice Fighter Podcast is brought to you by Justice Media. It's brought to you by the attorney Gerald Griggs and Gerald A. Griggs, LLC, and a host of other sponsors. So please tune in to every episode of Justice Fighter Podcast. We're on all podcast platforms, Spotify, Stitcher, Apple Play, Google. You can get it on YouTube. Go to the Instagram, go to the Facebook. We're going to be bringing you the information that you need to stay safe. This is Attorney Gerald Griggs, a Justice Fighter. I will be bringing you this information on the platform. So please subscribe, please like, please share, please tune in, and please tell a friend. This is Attorney Gerald Griggs, a Justice Fighter. I will be talking to you. Thank you for listening, and on to the next episode.
This is the Justice Fighter Podcast. With Attorney Gerald Griggs. Where we have conversations on social justice, civil rights, and political news that affects us all. Let Attorney Griggs put you on game. Only on the Justice Fighter Podcast, y'all.